welcome to everyone. It's a great pleasure to be here today to launch the World Stroke Day campaign 2021. I'm Sheila Martins from Brazil, and my co-chair here is Deidre Silva from Singapore. It's a great pleasure to have with us Sarah Benson, International Development Manager from World Stroke Organization, Maeve Bales and Monty Mortara from Campaign Agency, and Anita Wieserman, Campaign and Partnership Manager. Deidre, please.
Right, so good evening, everybody from Singapore, and I know we're in various time zones, but we're very excited today to be with you to launch the World Stroke Day campaign for the World Stroke Organization for 2021. We're going to see today some of the key visuals and some of the exciting developments that we have for this year, but if I could just move to the next slide, just to remind everybody why we do this, and we do this to try and promote awareness of stroke. Anita, do you mind moving one slide down? We have two key messages. Our key messages are, to recognize stroke and the FAST message, as well as about stroke prevention. Since 2019, we have adopted a 2-year plan where we have a same theme going on for 2 years. So in 2019, 2020, our message was mainly about prevention. For 2021, 2022, we're focusing on FAST. Of course, all the World Stroke Day material from past campaigns is on the website. I urge you to go and have a look at it. There's a wealth of information there. And, even though we have a campaign specific for 2021, there's lots of material there that you may find useful and you may want to use for this year, even if it was material from past campaigns. It's really a lot of information, many of it translated into various different languages. And so I just strongly urge you to go and have a look at it. I think the campaign, we really try to make it focused so that it's something that will reach out to many people and has an international flair as well. And we hope that all our member organizations, partners, stroke support organizations will feel that the material is useful to them and will use it. Of course, it's freely accessible to anybody who wants to download the material from the website. We hope that it will give you material that you can use to advocate for stroke in your region, whether it's stroke prevention, for FAST awareness, as well as life after stroke advocacy. So without further ado, I shall pass on to the campaign agencies so that we can see what is the exciting campaign that we have for you this year.
Thank you very much. We're going to share our screen now. So we'll just be sharing a deck that we've put together with what the toolkit looks like and the materials that we've developed. And if you have questions, we're very happy to take them as we go, actually. So please feel free to interrupt us. Our agency is Charles Cannon. We're in Geneva, and we're so pleased to be working on this campaign. It's something that we're all really passionate about, and we feel very lucky to be part of it all. Essentially, this is what the toolkit looks like. So if you download it from the website, it will look exactly like this. We just talk a bit about the goals for World Stroke Day, and then we go into what the idea is for this year, what assets are available, some ideas, a creative showcase, and how to make the campaign yours. So these are not our numbers. These were the numbers that you managed to achieve last year, and it was absolutely amazing. Obviously, we want to do just as well or even better this year, but to see that level of global engagement in this campaign is just extraordinary. From the number of countries getting involved to the reach of the campaign, we really want to even beat those numbers if we can this year. So well done to everybody who was involved last year. The brief for us and our overall campaign objective is really to raise awareness of the signs of stroke, so the FAST signs, and then the importance of saving time when somebody is having a stroke. And we've called that precious time for a number of reasons you'll see in the campaign, but it's really awareness raising and then the benefits of saving time. We want to reach the maximum number of people. We'll be measuring that on social media, and we also have a press release as well, and a campaign hashtag of precious time that we'll be able to see how that's performing. as well as reach, obviously we want to make it engaging. So the more people that are liking and reacting to the content, the better. And to really have one voice as a full global stroke community for the day, to get as many people as possible activating the campaign. And that's why we've tried to make it just as easy as possible through the toolkit and the downloadable material for you all to customize the assets and to use them in whatever way is the most useful to you.
Sorry. Yes, so now we'll go into the big idea for the World Stroke Campaign. And the main concept was precious time. The idea came from time is tissue, or time is brain, as it is known in the medical field. As we know, when somebody has a stroke, every second that goes by is crucial. And as brain tissue and millions of neurons begin to fade away, time could not be more precious. This is a 2-year campaign. It's really aimed at raising general public awareness on stroke symptoms and the importance of acting fast when you spot them. And after we're going to go into the FAST iconography also that we've developed. This toolkit really wants to communicate what can be saved that's really the creative idea. So it's a life, but also independence, a quality of life, and precious memories. This toolkit gives you really the opportunity to bring the campaign to life through a global poster campaign, updated fast icons, social media posts, and PR messaging. This is the new iconography that we developed. There were several things that we had in mind when it was being developed. As we know, in today's world, a lot of things are viewed on mobile screens, so it was important that these symbols could be easily recognizable, even in a small size, fighting for attention. Also, they are simple, genderless, without ethnicity, yet human and urgent. So really easy to spot and understand within any context. In terms of key visuals, what we put together was the posters that could really give the messaging towards either the emotional hook, the call to action, and the symptom spotting. Really, whatever you feel is most important in your market in this moment. So you have the headers, which are minutes can save lives, and then you'll see that they can be interchangeable with minutes can save memories, mobility, speech, and independence. Then we have the sign off, learn the signs, say it's a stroke, save, hashtag precious time. And then you can have the logo of the World Stroke Organization. And of course, if there's co-branding, then that can be included as well. Then you have the call to act. You have another variable which has the call to action, learn the signs of a stroke, save, hashtag precious time. And then again, the sign off, the logo, and the co-branding. And of course, we always have the iconography and the fast messaging below. And then this one is a little more bold. So you have, for symptom spotting, the header, which is just stroke, the focus on the symptoms, the sign off, the logo, and the co-branding. Here, I'm just going to take you through the different key visuals. So we have throughout the campaign, you'll see that there is the particle dispersion, which represents the precious time, the strokes, everything that we can lose. So we've made sure that we have it is a global campaign, so it's representative, which global representation. So I'll just go through these. And then we have the icon animation. So we created an animated iconography. I'll just go ahead and play.
We'll see these a lot in the campaign.
Yes.
We know when you animate things, they're 9 times more likely to catch people's attention than static. So we've used them animated throughout all of the social media assets and the video as well.
Yes. And then I'm not sure if everyone has seen this, but this is the campaign video. So I'll just go ahead and play it. This is the 1-minute version.
What happens in the minutes after someone has a stroke? We lose crucial brain cells, the key to mobility, communication, and memory, the key to who we are. For each minute a stroke goes untreated, nearly 2 million brain cells die, and a part of us fades away. Taking action in these precious moments is vital. When we know the signs, face drooping, arm weakness, speech difficulty, and act fast, we can save a life, a future, and a past. We can save treasured memories, valuable independence. So let's look out for each other. Learn the signs of stroke and be ready to save precious time.
So this was really the main video, the 1 minute. There's also an existing 30 seconds. And then we also have animation through social media posts, which we'll go into. There's a leaflet available for the markets that they want to customize and roll out. In terms of brand identity for World Stroke Day, the main idea here was to really use the O surrounded by fragments, which represents what happens when somebody has a stroke. So the damage to the brain tissue and the loss of what that tissue holds, the memories, the reasoning, the language, the emotions. And then we've done everything, of course, within the World Stroke Organization corporate identity. So the green and the blue, all the colors. And this is used throughout the campaign's creative. We have Michael Johnson, who will be joining us for the webinar on World Stroke Day. So this is our face for the global campaign really this year in terms of influencers. We still have others that perhaps will join or that could join the campaign, but that hasn't been fully agreed yet. So yeah.
He's going to be on the panel and he will be a voice of a stroke survivor, telling us his story and then why it was so important for him that he was treated quickly. And you know, he's one of the lucky ones really in a global context that he got to hospital fast and he received treatment and rehabilitation. But we'll talk more about the panel overall. It will be, I think, a very good high-level panel event, but he will be there and his agent is happy for him to promote it and to draw kind of more public attention to the campaign. I could see, Anita, there was a couple of questions in the Q&A, but we can't click in them when we're presenting. You're on mute, Anita.
I'm just answering them now.
You are, okay.
I think we can return to the Be Fast one in the discussion. So I'll just, okay.
Yeah.
So actually, yes. So then we were going into the webinar panel event, which is taking place on World Stroke Day. So this year, obviously we have Michael Johnson, which we just spoke about.
Anita, did you want to mention any of the other panelists that are in scope for that?
We are expecting, we haven't got them, the only person who is actually, people that are fully confirmed at the moment are Sheila as the co-chair and of the campaign and president-elect for WSO, Michael Johnson, and we have we have Padma, who is an Indian neurologist, who's been a very passionate advocate, who will talk about some of the issues around implementation on the ground, particularly in low and middle income countries. And we're expecting some input from WHO, who have confirmed that they will. And Sheila, I believe we will have the Minister of Health from Brazil as a panel member too, talking about policy issues and some of the work that they've done in Brazil to advance stroke prevention, treatment and care.
And we'll have a moderator from ITV, Raghi Omar, who is great at moderating these kind of panels and keeping the discussion going. And it will really be around access to acute care and how that can be advanced at a global level and what it will mean for people practicing in Brazil, India, etc. Okay.
And then for social media and digital assets, we've created animated versions of the key visuals, as well as static versions. All of these, of course, we display #PreciousTime throughout the campaign. We've also created the World Stroke Day logo and the iconography, which in static versions, which can be communicated. And then we have social media and email banners, which can be used for Facebook and Twitter and Instagram.
We have a few ideas. They're more ideas than anything that's concrete, but it's just ways of making the campaign sort of come to life, you know, outside of the toolkit that we've provided. So because the theme is about time, if you have a famous clock in your country, if you're going to do an illumination, it would be brilliant if we could tie the things together, the message of precious time. So obviously we chose Big Ben and the Horloge Fleurie just because we know them very well, but I think it would be great in any country in the world if we could illuminate clocks on the theme of precious time and get people talking about it on social media. Some other ideas that we had, obviously people love mugs, flags, things like that. I think that it can look really iconic across a whole range of channels, t-shirts, etc. And if anybody wants print files for things like this, if you get in touch with Anita or us, we can very, very quickly and easily make them. It's not a big or time consuming or even costly thing for us to do. There were just some nice ideas to bring it to life. And then for making it yours and adapting it to your own local market needs, as Monsi said, we've tried really hard to get a broad range of images for the image bank that you can select, as you can see here, that would be right for you and for what your messaging is. So there's some primary images there and additional ones on the kind of the themes that we have about Save Memories, mobility, speech, independence and lives. So all of those are available for you to use. And then there is, of course, the existing campaign, which is great for schools and children. That will always be there. It's separate to this, but as well, it's available. And we've included in the toolkit here just to remind people that if you are going to do a schools activation program so that children can bring the knowledge home, then the Fast Stroke Heroes campaign is available and their toolkit as well. I think now we're back over to Anita for some key dates and exciting things that are happening in the next few weeks.
I better unmute myself then. Yeah, so thanks for that, Maeve and Montse. It's a really comprehensive toolkit, I think. If I could just highlight one thing that we will be providing that wasn't in the toolkit that was presented there. It's an online testimonial builder where people will be able to go to the website and put together a very short micro story about the difference that FAST has made to them with their own photograph. It will be a kind of World Stroke Day themed, and we'll use the design elements that we've seen in the rest of the campaign there to help us really bring this campaign to life with individual stories of survivors, family members, and that can help our members to also highlight specific issues for their communities. So please, that's the other thing that we're providing, and we really is important, and it's really important to our members to make that come alive. I wanted to just flag that. I'd had something in chat about it, so.
Yeah, I'm sorry, skip that one. It's a really important one. Yeah, storytelling. We absolutely make that available for people to show, to tell their stories, you know, and ASAP sort of thing. Yeah, yeah.
Yeah, we've already reached out to some of our members, and we have some to get the ball rolling. But yeah. So for key dates, we've shared all the assets and the translate that we're looking at the moment for the co-creation of materials. So we had a question in chat about translation. Well, all the resources will be translated into French, Spanish, Portuguese, and Hindi. If any of our members want to work with us to develop additional language versions of the resources, then please do get in touch with me, and we would love to facilitate that if we possibly can. Some of it will be dependent on our budget, really, because it always takes time to do the design work. But if you have some local design capability, that would be wonderful. On September the 13th, all of the assets will be available in translation on the public website. By September 20th, the testimonial poster builder that I was just describing, that'll be on the website and ready for people to start using, and just making sure that that hashtag is in the posts when they're shared, and all of those will be pulled through automatically onto the World Stroke Campaign landing page. So your stories will all feature on a wall of survivor stories and caregiver stories. On October 1st, the video that you've all just seen, you were all this is a kind of, that was a private viewing. The video will go public on October 1st. We're going to premiere that on our social media channels and create a bit of buzz about the campaign as part of our launch of the overall social media campaign. So we'd ask you not to, if you manage to come across it, please don't share it before that date. And on October 28th, we have our World Stroke Day press release will go out on the news wires, and we will share that with our members. We'll advise you before then of what our key messaging for that news release is going to be, so that you can look at aligning that within your local area if you want to. Our focus, unsurprisingly, this year is going to be on acute care, and Sheila is working on a set of recommendations from WSO around improving stroke care. These are being drafted out of the extensive survey that was done with WHO and WSO in partnership, looking at the state of the world's stroke. So there'll be a set of recommendations. We'll share those with you. Those will form the key messaging for our press. And if there are particular innovations or particular challenges in your country that you think would help us to build to get some PR coverage, please do let us know. And if you've got any PR activity that you're planning around acute care or fast awareness, please again flag that to us so that we can share that with our media specialist. And then on October 29th, as we highlighted, will be the high-level panel at 3 p.m. CET, and we really want to get as many people there as possible. So that's where we're at.
Yeah, so we stopped sharing so we could go back to your deck because there was some additional information.
So we'll just get back to where we were. So I'll just pass over to Sarah now, who can talk through some of the other webinars that are coming up to support our members and any stroke stakeholders who are interested in getting involved in the campaign. Sarah.
Thank you, Anita. So in response to our members, both professional and stroke support organisations who have asked us for support to develop their campaign skills. This year, we're really pleased to be able to host 3 online workshops, which will have input from global NCD and stroke advocacy and campaign leaders. And we'll be asking participants to think about how they would approach different campaign issues and to explore a case study, which will be focused on Sheila's work in Brazil. We'll also have some of our partners and members sharing their insights and experience, and we'll provide a list of useful resources as takeaways to help you develop your campaign activities. And we'll also be taking to Stroke Connector, which is our online platform to continue discussions in between the workshops. So we'll be really encouraging you to connect with each other and share your experience on our discussion threads on Stroke Connector. So the dates for your diaries are here. So September the 23rd at 3 p.m. Central Europe time, we'll be looking at how local data can drive the focus and goals of your campaign. And we've got speakers from NCD Alliance and the Stroke Association in the UK. And then on September the 30th, also at 3 p.m, we'll be exploring how to engage communities in your campaign. And for this workshop, we've got speakers from WHO and the stroke support organisation SASNET Ghana. And then finally on October the 7th, we'll find out more about communication tactics from our campaign agency, Charles Cannon, and also some very practical experience from the stroke support organisation Bindu Menon Foundation in India. So all the workshops will be recorded because we're aware that the time doesn't work for everybody. And registration is now open, and you can find out more on the WSO website, and it's located under upcoming webinars.
Over to Sheila.
Great, thank you, Sarah. Thank you, Anita. So it's very important to aware the population about the precious time, but the hospitals should be prepared to take care of these patients with a fast and organized pathway. So how to give a global drive to improve quality of stroke care. Next, please, Anita. For this, in 2014, the World Stroke Organization published the Global Stroke Services Action Plan to support the evaluation and progress of stroke care in all regions, creating a roadmap to give this global drive. So the roadmap classifies the stroke services in 3 levels and suggests resorts and protocols to be implemented in each level. The goal was to achieve as many check marks as possible in the roadmap to provide the highest possible level of stroke services. Next, please, Anita. So now, wherever you are, whatever your starting point, you can use the World Stroke Organization online self-assessment tool, World Stroke Organization online roadmap, that we are launching today in 3 languages, in now English, Portuguese, and Spanish, and is already in the World Stroke Organization website. The online roadmap is a self-assessment tool to enable the hospitals to assess their current status for stroke care using minimal criteria as a start point to classify in these 3 categories and to suggest elements to improve each category. The tool can help also hospitals in the organization, but also local health managers, Ministry of Health, scientific societies to evaluate the situation and the gaps in the region to see the opportunities for improvement, and also can identify hospitals with the structure to develop a stroke center. For example, the hospital will be classified as minimal stroke service, but the algorithm in the platform will identify hospitals with CT scan, emergency room 24/7, and blood test as a potential hospital to develop an essential stroke center using telemedicine, for example. Next, please, Anita. So here you can see how is the platform. At the end of, you fill the form, and at the end you see your status, the status of your hospital as minimal, essential, or advanced. And you can see here, congratulations, you have met the minimal criteria to be an advanced stroke center, but keep improving, check below what you can do to improve your center. And you can see here in the left side, a minimal hospital and as a potential to be an essential stroke center. So you can use this tool to evaluate the situation, for example, in a country, in a state, and to evaluate what hospitals can be stroke centers. In the middle, you can see the essential stroke center, and you can check what you need to improve, and in the right side, the advanced. Next, please. And you see here how much you achieve as the minimal criteria to be classified. This hospital, for example, is a minimal stroke center, and you can check below what you need to be an essential. And you can see here very easy how to improve the quality of your center. So that's the idea. You can use now, you can start today to evaluate and to improve your service. And very soon we will launch the recommendations for from the World Stroke Organization for organization of stroke care across the globe. That's it, Anita.
Thank you. So it's over to you now with these questions. So it's really finding out, we'd really love to hear from all of the participants about your thoughts and your plans for World Stroke Day 2021, how we can work together to maximize public awareness of stroke science, if there's anything we can do to help you and to amplify the work that you're doing. And also just in reference to the presentation that Sheila just made, are there any ways that we can kind of look to involve our members and particularly SSOs to support institution engagement in the care quality improvement agenda? So over to everyone else.
Anita, I thought I could just maybe make a couple of comments. I think we talked about the influencer. I think Michael Johnson is going to be a great influencer for this campaign. You know, the fact that he was a sportsman and an Olympic champion and such, you know, I think will really emphasize that stroke can happen to anyone. And the fact that he got treatment and did well is also an excellent testimonial. But I just want to encourage everybody that, you know, finding your own local influencers would be great to contribute to your own local campaign. And if these people have reach beyond your country, you know, if you could link it up with the World Stroke campaign, I think that would help to generate interest overall. So if you have any good contacts and you think that you know some people who may be willing to participate, please get in touch with us. I think working together is the way that we can try to get as much outreach as possible. The second comment I wanted to make is I think we brought up about lighting up the clocks in blue. You know, I think this is going to be a project that we will see grow over the years, and this is the first year, but I hope that everybody can try to just get a couple of clocks lit up and, you know, again, get some momentum going. And over the years, hopefully, you know, then maybe in every major city in every country in the world, you know, if we have this, it would really make a big stand and a big impact to advocate for stroke. I think we're going to try to get a letter out to help people reach out to partners so that you don't have to draft your own letters, so that you can appeal to them. And, you know, with the support of World Stroke Organization, hopefully we'll get some partners this year and see a growing trend. I think, Anita, you've kind of, there have been a couple of questions on the languages, right?
I've answered those. The only other question that was really around be fast and why we've made that decision to focus on fast, because I know we did have a lot of, it's not that we've ignored that exists or we're unaware of it, but we had a lot of discussion about this at the beginning of the campaign about how we were going to proceed on that. So perhaps you could explain that one.
So it did come up early. We talked about it a lot. I think there are varying opinions. Some campaigns have been using BFAST and have found it to be successful, and others have used FAST. And there's literature on both sides. And we did try to look at the literature to see whether that would help to guide us. But really, it can work both ways. We had to pick one because you have to have a common message in the campaign, and FAST was selected. But I think that if your country or if your region has used BFAST and you want to continue with that, there's nothing wrong with it. But there's a lot of material that is available, and if you can adapt the material so that you can use it for your campaign but still use BFAST, that'd be great. But I guess we had to make a selection. We had to decide, and we went with FAST. But I hope if you are using BFAST, that you will see that there's a lot of other material within the campaign from this year as well as from past year that you may find would be useful to you as well. Sheila, I don't know if you have anything to add to that.
No, I think it's exactly this. I talk about this because I prefer BFAST, but we discuss a lot and we decide to use FAST, but if you want, you can use BFAST in your country or region. I agree with you, Deidre. So we have several other questions here in the Q&A. I think Anita can answer, or Mivi, about to use imaging from national clocks. So basically, if you can get imaging of national clocks, do we simplify hashtag? I think you can customize to use in your country with your own images. You can do that. Other question is about, I don't know if you want to talk something about this, maybe, or Anita.
No, it was just because I know that some countries illuminate landmarks blue to mark World Stroke Day, and it's more aligned to the campaign, if possible, to illuminate clocks. Why not also, if you have a famous clock, you can share pictures of it, but I mean, it's just to draw attention to really the fact that every minute counts in a stroke situation. And this campaign is telling people, act fast. If you see someone having a stroke, if you're having a stroke, if you're a first responder, time is of the essence. So it's really just to use the clocks to get the message across in the best way that we can. I think it was Deirdre said it will probably take a while to actually get authorization. It might be next year that we manage to illuminate clocks. But why not try this year? And certainly we're happy to help with outreach messaging, if you want to write to any of your local authorities or landmarks. And we can put a messaging together for that, a short email.
So I guess if we do manage to get a clock lit, we should just hashtag precious time.
Precious time.
Yes.
Precious time. Yeah. Hashtag precious time. That's the key.
Yes. Yeah, that will be the campaign hashtag, and that will be measuring. So anything, whether it's clocks or testimonials or whatever it is that you're doing on social media, if you use the hashtag, then it will join into a bigger conversation and more people will see it in their feed as well. We want a trend.
Anita, could I just add something just about engagement with our community of people affected by stroke and stroke support organisations? So firstly, for the webinars, whilst we're compiling a list of resources that we think might be helpful to participants, it would also be great to hear from you about resources that have helped you in your campaign activities, whether they're from within the stroke and NCD world or beyond. So any resources that you think would be useful to other stroke advocates around the world would be great to hear about. And then just linked to the testimonials. This is a really important part of both the campaign, but also the World Stroke Organization, in raising the voice of lived experience and ensuring that is visible and recognized and given importance. And we don't want that just to be a one-off. For some people, it might be a one-off, that's what you want to do. You want to share your story and you don't need or want to engage with us further. But for other people who may want to maybe develop a blog from your experience, or connect to a stroke support organisation and maybe volunteer some of your time in their stroke awareness campaigns, then we'd also really love to hear from you. So I think there's an option to also, when you share your testimonial, to also get in touch with the campaign, and see if we can connect with you further and maintain a relationship with you. So that would be great to hear from you in that way as well.
And just to flag that, I mean, a lot of what we've focused on today has been online activity and, you know, some social, but we will, as always, and things are difficult and different now in terms of meetings and events, but I'm aware that there will be people who will still be planning to hold either virtual and or in-person events in the safest possible ways that they can in their communities. And the website will still have the facility for you to upload that. We really would love you to just share your plans for World Stroke Day, whatever those may be, because that's always great for us to have, and to have information about what you're doing. We do look at that. If there's we look at to see what's happening and see what we can highlight in our social media and elsewhere. And that's really always really helpful to help us bring the campaign alive and to show that this is a global effort and a global concern, and not just something that we've we've decided we're going to talk about for one day a week, but this has real relevance around the world and is real. So please do that. The website's live now and the registration's there. So if you have plans, please get them registered up there.
We have here also the question, Anita, can we translate the campaign video into our local language? I'm receiving through WhatsApp a lot of questions about it too. Everybody loved the video. And the idea is to give the video for translation in different languages.
We have there's co-creation work already happening on the videos. Maeve and Monse at the agency are working on those at the moment, and we'll have those in the core language. All of the resources that we've seen will be available in French, in English, French, Spanish, and Spanish, Portuguese, and Hindi. If people would like to translate for subtitles and apply those subtitles, we can provide, I'm sure that they're nodding, I can see Maeve and Monse nodding, we can provide you with the raw files that will enable you to do that. And we can get that available and over to you, and you can develop that locally for your own communities, and that's fine. Our aim is always to make it as easy as possible for you to make this campaign work for your audiences. We just have limited resources. So we have to do what we have to kind of make some decisions about where we're going to go with our language choices. But we really want to be able to support our members as much as possible to adapt and localize. I don't see any more questions. There was Mary has been posting around and has asked what we can do to help to highlight some of the issues around pediatric stroke. Yeah. And I saw that I had a message from Maeve and Monse with a suggestion there. Did you want to answer that one?
We're on mute. Sorry, I think that's the catchphrase of 2020 and 2021. I'm on mute. We had a picture. Do you remember earlier, Anita, in the campaign, we had some nice imagery of younger people that we could add some to the image bank. I think it would be no problem for us to do that. We'll just double check them again to make sure it's the right sort of ages and ethnicities and things.
Mm-hmm. Yeah, we can certainly. Yeah, Mary, there's and for anybody else that's interested, there is an image bank that's available to our members. We sent a Dropbox link to members. If you would like that and you want to be able to access those images, just get in touch if you haven't already received them, and we can provide the link to you for that. Although there should be there and available to download from the website already, I imagine. That all the resources went up there today. We can check. If you want them now and they're not there, we can get them to you, but I do imagine that they are there, or we can get them up there in the next 24 hours.
They share here the link for the International Alliance for Pediatric Stroke with the fast signs, together with American Stroke Association. It's a beautiful folder here. And we have the Fast Heroes campaign that is a great success in several countries for children from 4 to 8 years old. And really the children learn the signs and the number of emergency medical service, local emergency medical service, and the children teach the parents about the stroke signs. So I think this is a great campaign you can spread in the whole world.
And I just want, just to highlight that it will be coming very soon from the Fast Heroes team, but they're developing a specific World Stroke Day tailored campaign for young people, and that's the resources from that will be loaded up onto the campaign website too. So you'll be able to, as members, access that and participate. And they've got a specific call to action for World Stroke Day, that they want to beat a world record of people wearing superhero masks and sharing photographs of themselves. So Sheila has already led the way on that one. You'll find a picture of her online wearing her superhero mask. So that's something that's specifically there for the engagement of young people and their families in World Stroke Day. So yeah, we would love to see you see our members engaging in that and helping to get that message out. There's a lot of really good resource there are in that Fast Heroes Toolkit online workbooks. They've pivoted all of their school, it was a school education project. When schools closed due to COVID, they pivoted everything onto online. So there are really great downloads and activities that you can do with children. So yeah, do check that out. Again, that'll be live tomorrow.
That's great, Anita. So
any more questions? Mary Kay says she loves the superhero masks, so that's great. We'll look forward to seeing you in your superhero mask, Mary Kay.
Yeah. That's great. Okay, I think we don't have more questions.
I think that's, yeah. So thank you, everyone. And yeah, you'll find contact details for the campaign on the website. So anything you need, just get in touch.
I think it's important to remember to apply for World Stroke Campaign Award.
Yeah.
That will be very interesting, very important, and we will wait for you for your campaign to a great contest.
Mm-hmm. Indeed.
Okay.
Oh, we have
another comment coming in. Yes, we really want people who are stroke survivors to do testimonials, and that's a big thing that we want to invite people to use, the kind of social post builder that Anita referenced, where you can tell your own story and upload a picture. And we really want to hear from people who have witnessed strokes, stroke survivors, people that are working in stroke care. I think it's just a way of allowing everybody to tell their story, because that's what people connect to, really, is personal stories in the end. So we agree, Luciana. Yeah.
Okay. If there are no more questions, has anyone got any last burning question or comment that they want to make?
Oh, I thank you.
It was just a thank you. Okay. Well, thank you everyone for attending. We will be posting the recording of this webinar on the campaign website. So if there are other colleagues or team members that you want to share this with, it's there. Please do get the word out, help people to understand the campaign and how they can get involved. And we are really looking forward to working with you for October the 29th. We love the campaign. We think it's beautiful, and we're really proud of it this year. So we hope you find it something that you can really get behind too.
Thank you.
Great. Bye-bye.
Thanks, everyone.
Bye.
Thanks, everyone.